Hey guys, welcome back to another edition of Health Class. Welcome back to my channel. Today we will be discussing about an important diabetes topic. It's about hypoglycemia. That's a medical term for low blood sugar level. What is hypoglycemia and what will happen if a person suffers from hypoglycemia, and what to do in order to treat hypoglycemia and to prevent it from happening? If you want to know more, keep on watching. Again, welcome back to my channel. My name is Ryan and I am specializing in alcohol and other drugs, primary care, men's sexual health, and diabetes. So for this video, like what I told you earlier, we will be discussing about hypoglycemia or low blood sugar level. People with diabetes need to know what hypoglycemia is, and they need to know the signs and symptoms of hypoglycemia, as well as how to manage or treat hypoglycemia. This will be a basic video about hypoglycemia, guys, and these are the important information that people with diabetes need to know in order for them to safely manage hypoglycemia at home. So let's start. Hypoglycemia or low blood sugar level is when your sugar level is low. And generally it is 4 millimoles per liter and below. Now it will depend upon what unit of measurement you're using. In Australia, we are using the unit of measurement millimoles per liter. Anything, any level that is below 4 millimoles per liter is considered as hypoglycemia. That means your sugar level is low, and if it's not treated, it will go further down, and that is very dangerous. What are the signs and symptoms of hypoglycemia or low blood sugar level? The common ones are shaking, dizziness or lightheadedness, sweating, hunger or nausea, looking pale, an irregular or fast heartbeat, difficulty of concentrating, feeling weak or having no energy, and if left untreated, it can lead to unconsciousness. Or if you are up and about, doing your shopping, walking along the road, or if you're driving, which is more dangerous, you might just collapse. Speaking of driving, in the state of Victoria in Australia, we have this campaign for people with diabetes who are driving, 5 to drive. That means you need to make sure that your sugar level is above 5 millimoles per liter before you hit the road. That means you'll be safe driving, you'll be avoiding hypoglycemia, you have this peace of mind that you will be driving safely along those busy roads because your sugar level is in the right level. In the state of Victoria as well, for example, there is a requirement for people with diabetes that they need to report to the Victorian Road Authority that they have diabetes. It is a requirement. And most of the time, they will require to have eye tests on an annual or yearly basis, just to make sure that they are safe in driving. So what is the current recommendation? According to NDS's annual cycle of care or National Diabetes Services Scheme, the current recommendation for eye tests is at least once every 2 years. But if the eye professional, such as the optometrist or ophthalmologist, will say, I need you to come back in 3 months' time, or I need you to come back after 6 months, or I need you to come back after 1 month, or I need you to come back after 1 year, then we need to follow that. We are not just making sure that you are safe in driving, but also we are preventing diabetic retinopathy from happening. If you want to find out about diabetic retinopathy, you can watch my diabetes complications video that I have posted a few weeks ago. So, what are the main causes of hypoglycemia or low blood sugar level? There are a few. One of them is if you're not eating enough. Obviously, if you're starving yourself because you're wanting to lose weight and you are not eating enough, instead of having 3 main meals a day, you only eat once a day. As a result, there's not much sugar left in your body. There's no food in your stomach that your body can process and convert it into sugar. And as a result, your sugar level starts to drop down. And that is very dangerous. Other common causes are medications, especially those medications that can cause hypoglycemia. Yes, they are effective medications to reduce blood sugar levels in your body, but they can also cause hypoglycemia or low blood sugar level if you are taking too much of them. One oral tablet that can cause hypoglycemia is a drug called sulfonylureas. Also, insulin. If you are taking insulin, there's a high chance that your sugar level will go down. Insulin is a very potent medication that lowers blood sugar level. If you are taking too much insulin and if you're not eating, plus you are exercising too much, then there's a high chance that your sugar level will just drop down. Exercising too much. It is important to check your sugar levels before you go and do your exercise. It's the same with driving. Before you drive, you have to make sure that your sugar level is within the safe level to avoid hypoglycemia. It's the same thing with exercise, especially if you're doing a hardcore exercise. You have to make sure that your sugar level is in a safe level before you do heavy exercises. Other causes are excessive alcohol drinking. Drinking heavily without eating can keep the liver from releasing glucose or sugar from its glycogen stores into the bloodstream. This can lead to hypoglycemia. Some critical illnesses, severe liver illnesses such as severe hepatitis or cirrhosis, severe infection, kidney disease, and advanced heart disease can cause hypoglycemia. A rare tumor of the pancreas called insulinoma can cause you to produce too much insulin, resulting in hypoglycemia. Other tumors also can result in too much production of insulin-like substances. Unusual cells of the pancreas that produce insulin can result in excessive insulin release, causing hypoglycemia. Also, hormone deficiencies, certain adrenal gland and pituitary tumor disorders can result in an inadequate amount of certain hormones that regulate glucose production or metabolism. In severe cases, if hypoglycemia left untreated, it can lead to seizures, coma, and death. We also have what we call hypoglycemia unawareness, and this is actually a little bit dangerous too. Over time, repeated episodes of hypoglycemia can lead to hypoglycemia unawareness. The body and brain no longer produce signs and symptoms that warn a low blood sugar level. When this happens, the risk of severe, life-threatening hypoglycemia increases. If this happens to you, you need to talk to your doctor or to your health professionals, because if you are taking medications, then your medication might need to be adjusted or modified. How do you treat hypoglycemia, or how do you manage low blood sugar level? If your blood sugar level is less than 4 millimoles per liter, treat with one of the following. 1 is a glucose drink. 2, jelly beans. 3, a regular soft drinks, not the diet ones, but the regular ones, such as the regular Coca-Cola. Oral sugar gel, 1 tube. You can buy it from your local chemist. And then there are also glucose or sugar tablets that you can buy from your chemist. So how do you use these products? What are the steps? If your sugar level is below 4 and you are experiencing these symptoms of hypoglycemia, you can choose from one of those options. Let's choose 1 can of Coca-Cola. When you check your sugar level and you find out that your sugar level is, let's just say 3.5 millimoles per liter, then what you need to do is to treat your low blood sugar level. You grab a can of Coke and you drink it. The second step is to wait for 10 to 15 minutes and recheck your sugar level. If your blood sugar level is still less than 4 millimoles per liter, then you repeat step 1 again. After waiting for 10 to 15 minutes and you recheck your sugar level and it is still below 4 millimoles per liter, then you need to repeat step number 1, which is you either drink another can of Coke or you eat 5 pieces of jelly beans. You need to wait for another 10 to 15 minutes and then recheck your sugar level. Rechecking your sugar level after 10 to 15 minutes is making sure that the step 1 has been effective and that your sugar level is now above 4 millimoles per liter. If your blood sugar level is more than 4 millimoles per liter, then you can have a low GI carbohydrate snacks after this. For those of you who doesn't know about carbohydrates and low GI or glycemic index, watch my video about carbohydrates and glycemic index. And always remember, you need to report your hypoglycemia episode if it happens to your healthcare professional or to your doctor. If so happen that the person suffering from hypoglycemia and unconscious, please do not give food or fluid. Dial your emergency number to call an ambulance if you think you can't manage your hypoglycemia, or if you've followed those steps but nothing is working. Then that's a time that you need to call an ambulance, because you need to be taken to the hospital for immediate treatment. I would advise for you guys to carry jelly beans with you all the time. Put some jelly beans in your purse, in your bag. Put some jelly beans in your car. Because if you feel the symptoms of hypoglycemia, then what you can do is to grab some of those jelly beans and then eat them with the aim of increasing your blood sugar level for you to be safe. There are people out there whose blood sugar levels are normal. Let's just say 5, 6, 4.5, 5.2. These levels are within the normal range, but they're already experiencing hypoglycemia symptoms such as shaking, unable to concentrate, sweating, confusion, excessive hunger. The take-home message here is no matter what number you will get every time you check your sugar level, it is important to listen to your body. Even if your sugar level is normal, but then you are experiencing the hypoglycemia symptoms, then you need to consider it as hypoglycemia or low blood sugar level, and you need to treat it. You need to manage it, because the last thing that you don't want to happen is for you to collapse and become unconscious. Even if your sugar level is normal, but you are experiencing the hypoglycemia or low blood sugar level symptoms, then you need to follow the steps in treating hypoglycemia. That's it for this video, guys. I hope you've learned something about diabetes, hypoglycemia, and its management. Share this to those people whom you know who will learn from this video, especially to those people who have diabetes, and especially to those people who are experiencing hypoglycemia from time to time. Thank you for watching this video. Stay safe and be healthy.